is so important that health professionals learn to recognize near-death experiences. It is known that over 5% of the population experience these kinds of phenomena. And that's an amazing number. It's over 15 million Americans and 1.5 million Canadians. And it seems surprising because people often don't talk about it. Why don't they talk about it? They're afraid that if they tell their doctor or other healthcare professional that they'll be labeled as delirious or psychotic or bipolar, or that such an important experience for them will just be trivialized or minimized or dismissed by the health professionals. They're often afraid to talk about it with their religious leaders, their rabbi, priest, minister, imam, because they're afraid that they'll be told, oh, well, that's not the party line, and perhaps that wasn't such a spiritual experience after all, and you better be quiet about it. So patients often are afraid to actually discuss these experiences with their healthcare professionals. So it is important that healthcare professionals learn to recognize it so that they can discuss these things with the patient. Furthermore, this topic is now becoming mainstream with the general public. It's appearing in best-selling books. It's also appearing in major Hollywood blockbuster movies. And so it's important that physicians and other healthcare professionals be current with what the general population knows. After all, what physician wants to look foolish in knowing less about the topic than the patient? So it's really important that doctors become informed. I have used the video Near-Death Experience, What Medical Professionals Need to Know, in a variety of clinical situations. I appreciate that it is clear and organized and concise and includes descriptions by people who have had such experiences, as well as articulate and down-to-earth comments by people from various medical specialties, including those from neurosurgery, psychiatry, critical care, orthopedic surgery, as well as nursing and chaplains. So it really cuts across the board and provides a very solid clinical perspective on these experiences. I have used it with various clinical groups, including physicians who were in practice and physicians who were in training programs such as residency programs and fellowship programs. Often, I find that the groups want to talk more and want to meet with me afterwards. They're so enthusiastic. And this is an exciting topic for them to find that they can discuss actually openly in a medical environment. I recently spoke with a hospice worker who had decided to show the video to the staff. Before she showed it, she asked them, has anybody had any experiences with near-death experiences or heard about patients or families who've had them? And she looked up to see a sea of blank faces, expressions, and some nervousness. She showed the video, and then after it was over, she asked the same question. And one by one, people put up their hands that they had known a patient or somebody who'd had such an experience. So the video helped them to recognize what they'd been hearing. Finally, the video provides clear information and recommendations about how to deal with these situations, how to ask appropriate questions, how to respond appropriately, and how to make appropriate referrals. It helps professionals to be able to offer a richer level of support for patients and their families.